Hi, I'm Dr. Inbae Cho of G7 Clinic of Seoul, South Korea. Today, I'll discuss the practice of liposuction for middle-aged and older women. Oftentimes, it is thought that liposuction is limited to women in their early 20s and 30s. However, this is not exactly the case. In reality, women from their mid-40s, 50s, and 60s are all undergoing liposuction. Recently, even patients in their mid-60s and early 70s are present. For this reason, I wish to characterize liposuction, specifically abdominal liposuction, for middle-aged and older women to clarify the nuance that lies behind the procedure itself. To give you an example, this person in her early 50s had already given birth and had lived without specific care before coming in for liposuction at my clinic. Here, you can see the loosened skin, the slight creases caused by the loosened skin itself, which eventually resulted in the infolds of skin you can see here. This is very commonly seen and is a major target characteristic of liposuction in middle-aged or older women. Another characteristic is often the development and accumulation of intra-abdominal visceral fat in the gut area. After giving birth, it is common that not only the subcutaneous fat, which is located above the muscle wall and is quite visible, but also not visible, deeper visceral fat accumulates surrounding the gut that lies beneath the muscle wall itself. This accumulation of visceral fat can be found and seen as a connecting strip from just under the breast to the pubic area, as is being traced here. The third characteristic is the division of fat into compartments, in this case three, with upper and lower stomach, and just above the pubic region. Here you can also see the two divisions itself, which is along the umbilical line as well as the pubic line, where fibers have accumulated, which cause striations and divide the concentrations of fat above and below the line. Another characteristic to consider is that in middle-aged women, their abdominal muscles are often very weak or have been weakened, and this is because during childbirth, the abdominal muscles undergo stretching and separation to accommodate the growing uterus. So naturally, when performing surgery, it is important to approach it with a gentle and delicate technique to avoid penetration and causing further damage to the weak abdominal muscles with the cannula. Special attention should be paid during surgery to prevent strain or injury to the abdominal muscles to ensure that the patient can continue with abdominal exercises without complications. Furthermore, another important aspect of women's abdominal fat is the presence of cellulite. It is quite common for women to have cellulite, even at the age of 62, where some women may have undergone a C-section for childbirth, which resulted in a horizontal or vertical scarring shown here. And during the C-section, adhesions may form between the scar and actually the surrounding fat, which cause a lumpy or bulging appearance shown on each side of the C-section scar here. Additionally, for women who may have undergone laparoscopic surgery, such as for uterine fibroids or ovarian cysts, as the example shows here, may also have scarring and adhesions that can affect the appearance of abdominal fat surrounding the depressions along the laparoscopic insertion scars. If we consider another side profile, you can also see that this still holds true and is even further indented. Another characteristic, or perhaps the most important characteristic to consider for middle-aged women, is some of them may have chronic conditions such as diabetes or hypertension, and therefore, when performing liposuction on these middle-aged women, doctors should not only focus on the liposuction procedure itself, but also consider the pre-existing conditions such as diabetes, hypertension, thyroid function, and other factors to ensure that the patient's health is not compromised during the surgery. As in the in the case of the person I described earlier, they had sagging and folding of the abdomen without much elasticity. However, post-surgery, as shown here, the elasticity was not fully restored. However, the fat was removed and the abdominal appearance was actually maximized. From the side view, you can see that the abdomen, which was again previously sagging and folding, has improved, and the skin crease is actually gone as well. However, there is still some visceral fat present, so there's a slight unevenness even after the surgery. Similarly, in this case, the abdominal area, which was previously folding and sagging, has improved after the surgery. However, there is still some looseness or wrinkliness due to the skin elasticity, which there was too much fat for it to be completely reduced. In this individual, in their early 60s, the folding and sagging area has once again been improved and the upper abdomen has become more clearly defined, as well as the love handles being reduced. This individual also had very little skin elasticity, so even after surgery, it was inevitable to have some slight irregularities in the skin. However, they were still very pleased with the significant reduction in size and body weight compared to before. This is a picture of the day after surgery from the front view, where the sagging in the upper abdomen and the fat that used to protrude on the navel has disappeared, which results in a more vertically aligned navel. From the side view, there is also significant improvement in the upper and lower abdomen, following the bra line on the side of the chest, where there is a noticeable decrease in volume. Similarly, from the left side, there is evidence of improved love handles, as well as the bra line, where the fat has been thinned. From the back view, although the sagging wasn't completely eliminated due to the lack of elasticity, there is a significant improvement in the overall silhouette and body shape of the patient. In this case, the individual was 62 years old, and the previously folded and sagging navel area has improved after the surgery. The C-section scar on both sides was also significantly reduced as the fat along the scar was removed. From the side view, you can see there's a very visible transformation from the side of the chest to the back, as the area that used to be thickened and bulging was also straightened. As mentioned before, C-section scars are one of the characteristics of liposuction for middle-aged women. And before performing liposuction, it is essential to address these scars and any resulting depressions to achieve a successful surgery. In the case of this individual, the scar just above the C-section scar on the left side was addressed, which results in an even more even appearance after the surgery. For skilled surgeons, it is important to have techniques to address scars from various procedures, such as C-section as well as laparoscopic surgery scars, which cause less depth within the scar after the procedure, which allows for smoother outcomes. This person had experienced childbirth twice, and after addressing the previously folded areas, there was a noticeable lift in the abdominal region and a reduction in the laparoscopic surgery scar. This indicates that the skin has responded well to surgery, and from the side view, the previously folded lower abdomen was straightened and the overall silhouette became slimmer. Additionally, the cellulite on the upper half of the ribs was also improved. Thank you for watching. This was Dr. Inbae Cho of G7 Clinic, Seoul, South Korea.